Let's talk about corticosteroids. You know, they're some of the most powerful and widely used drugs on the planet, absolute lifesavers for millions of people. But what if the very treatment designed to save you came with a hidden price tag? One that you pay for with your own strength. Well, in this explainer, we're going to dig into the science behind that exact paradox. I mean, think about it. Rheumatoid arthritis, lupus, severe asthma. For a huge range of conditions, synthetic steroids like prednisone are medical marvels. Their ability to shut down inflammation is just a cornerstone of modern medicine. They're not called wonder drugs for nothing, right? But here's the catch. This is the big paradox we're looking at. The very medicine that's calming down inflammation and saving your organs can, at the same time, be waging this quiet, secret war against your muscles. So what is this thing? It's a condition called glucocorticoid-induced myopathy, or GIM for short. And listen, this isn't some rare one-in-a-million side effect. It's actually a pretty common complication, especially with long-term steroid use. And because the main symptom is just feeling weak, it often gets mistaken for the original disease flaring up, which means it goes completely underdiagnosed. So how in the world does a drug that's supposed to help you end up harming your muscles? To really get it, we need to zoom way in and see what's happening at the cellular level. And I think the best way to start is with a simple analogy. Just picture your muscles as a big building that's always under construction. Every single day you've got a construction crew, the builders, putting up new structures, which is new muscle protein. And at the same time, you've got a demolition crew that's breaking down the old, used-up protein. Normally, as you can see, these two crews are in perfect balance. Building up, breaking down, it all evens out. But when you introduce high doses of steroids, well, the whole system gets thrown completely out of whack. It's like they tell the builders to go on an indefinite coffee break while giving the demolition crew double pay and brand new sledgehammers. The result is way more breakdown than building, and that means you get a net loss of muscle. And right here, you can actually see the result of that imbalance. This is a cross-section of muscle tissue. The steroids are picky. They specifically target the big, powerful, fast-twitch fibers. Those are the ones shown in brown, and they're responsible for your strength. You can see how they've just shrunken and atrophied. Meanwhile, the pink fibers, these slow-twitch endurance ones, they're pretty much left alone. Okay, so we know what it is and how it happens. But if you're the one feeling weak, how does your doctor figure out that it's this and not something else? Well, that brings us to the diagnostic pathway, basically the detective work. The first clues are always in the symptoms. The weakness is really specific. It's typically painless, and it's symmetrical, so it affects both sides of your body equally. It's also proximal, which is just a fancy way of saying it hits the big muscles closer to your torso first, your hips, your thighs, your shoulders. And this translates into very real, everyday problems, like all of a sudden it's a huge effort just to get out of a chair or climb some stairs. Now, to navigate all this, doctors don't just guess. They follow a systematic approach, kind of like this flowchart here. It's their roadmap. It guides them through a process of elimination, using blood tests and nerve studies to rule out other conditions and zero in on GI maze as the real culprit. One of the very first and most important steps is a blood test for an enzyme called creatine kinase, or CK. Now, in most muscle diseases, when muscles get damaged, they leak this enzyme, so your CK levels in the blood shoot way up. But here's the strange twist with GMI. The CK levels are usually totally normal or maybe just a little bit elevated. It's a huge clue, but you can see how it could be confusing at first. And that really is the million-dollar question for everyone involved. Is the weakness from my underlying condition, or is it from the medication I'm taking for that condition? To get the real answer, sometimes you have to look even closer. I mean, literally inside the muscle itself. A muscle biopsy can give the definitive answer. Take a look. On the left, that's a sample from a gym patient. You'll notice the muscle fibers might be small, but the tissue itself is clean. There's no inflammation. Now look at the sample on the right. That's from someone with an inflammatory muscle disease. See all those little dots? The tissue is flooded with inflammatory cells. That's the critical difference. Gym causes muscle to shrink, but it does it without inflammation. Okay, so a diagnosis has been made. And now for the really good news. GIM is often reversible. The focus completely shifts from figuring out what's wrong to figuring out how to rebuild that strength and get back to normal. The management plan really comes down to three key things. First and foremost is adjusting the dose. If it's safe to do so, the doctor will gradually lower the steroid dose, and often people start to feel a lot better within weeks. Second, if possible, is switching the type of steroid. Some are just riskier than others. And third, and this one's non-negotiable, is starting a targeted physical therapy program. But when we say physical therapy, it doesn't just mean any old exercise. The research is pretty clear on this. You need resistance training to directly fight that muscle loss and aerobic exercise for overall fitness. But, and this is super important, you have to avoid really high-intensity workouts because they can actually backfire and make the weakness worse. The whole approach has to be strategic, not just aggressive. So, these strategies are definitely effective, which is great. But the ultimate goal, the holy grail, is to stop gym from ever happening in the first place. So let's just take a quick look at where the science is heading to try and make that a reality. You know, not everyone who takes steroids gets this condition, so why is that? Well, the answer seems to be hiding in our DNA. New research is starting to pinpoint specific genetic variations that can make one person more susceptible than another. It seems like our genetic makeup can really influence how our bodies handle these drugs. And that leads us to a final, pretty cool thought. Imagine a future where, before you even start steroid therapy, you get a simple genetic test. A test that could tell your doctor, hey, this person is at high risk. They could then take preventative steps right from day one, truly personalizing the medicine, and finally, protecting patients from that hidden cost of these powerful wonder drugs.